right, look, we got another one. Well worth the wait. Okay, hello everyone. Welcome to today's session. As you see, there's a few of us up, and we have a really interesting presentation for you all. But you knew that. That's why you came here today, right? So, just to let you know, I'm Joe Gallagher. I'm a longtime patient, going to help be facilitating today. But more importantly, we have our guest speaker who you actually came to see. So I'm going to introduce Sandra. So this is Sandra Nuttin. She was born in Belgium. She's been nursing for 25 years. She began her career at Grand River Hospital in Kitchener, and she's been working as an RN in the medicine and palliative care unit there before joining the hemo unit. She later transitioned into peritoneal dialysis, and finally she switched over to home hemo during the pandemic in 2020, which I'm sure, as you know, became a much more important treatment methodology as patients were looking to get out of the clinics. It wasn't a great time to be in the hemo clinics at that time. But so that's how she's been spent a lot of time now on home hemo. And in 2003, she actually took a big career pivot change, took a big leap of faith, and joined a company called Kidney Labs. There, she's helping to develop a revolutionary miniature hemodialysis machine that requires only a few saline bags to produce dialysis. So this is a new novel technology for administering dialysis. It's very exciting. Her gamble paid off, as the technology has since been very successful in its animal trials and is now in preclinical trials as well. So the technology is demonstrating successful and is going through the steps to basically become a functioning developed product. So we're all hoping to see that go forward. Basically, what I can say is her entire nursing career has been dedicated to improving dialysis care to her patients and advancing the technology to make dialysis more accessible across the globe. So thank you, Sandra, for all your hard work. We're really happy to hear from you today. We're excited to hear what you have to say and looking forward to asking questions later.
That sounds great. Thanks, Joe, for the nice introduction. So I always like to tell everyone I'm a dialysis nurse first. You know, that's my specialty. Presenting is becoming my next specialty, maybe. I don't know, but I'm here to, help you understand home hemodialysis a little bit better and share some exciting advancement in kidney care. So I'm getting help from my niece here to share my presentation. I want to with the notes. So just one moment. I'll share again. Just be patient. Remember what I said. There. No, not on slideshow.
And just for everyone's reference, this is being recorded.
Yes.
And if you do have questions, please ask them at the end. And everyone has been muted, so just FYI. And Sandra, we see your notes.
Oh, okay.
Perfect.
You see my note or just the slides?
Your slides now.
Okay, perfect. That's excellent. Thank everybody for your patience here. So again, I want to say thank you for allowing me to, share some general information about home hemodialysis, which is a big passion of mine. I've worked in home hemo for 13 years. So, thanks for taking the time to listen to me. And I just wanted to provide a little reminder that I can only provide like general answer. As I do not know your full medical history. So if you do have more specific answer, maybe you need to speak to your nephrologist or a nurse practitioner if you have that in your unit. So my objectives really here today are for you to learn maybe one new thing about home hemodialysis, maybe that one thing that will help you make a decision if you have to choose a modality in the near future if you have not started dialysis. And if you are already on dialysis and you've been thinking about doing home hemodialysis but have hesitation, maybe this presentation will help you take that leap of faith and maybe you'll give it a try. So we will also discuss things to consider, whether home hemodialysis is the right fit for you or maybe it's not, and we'll do that by discussing some benefits and common concerns that patients have. I will also highlight some successful story about patients who've chosen home hemo, and then you'll see sometimes a successful story that may not sound like what you think it may be. And finally, as Joe stated in my bio, I will talk about some exciting opportunity to advance kidney care, and I will do that towards the end of this home hemo presentation. So let's get right to it. So let's talk about the benefits of choosing home hemodialysis as a modality or transferring from in-center to home hemodialysis. So the first benefit that most patients will tell you is the flexibility. So when you do home hemodialysis, you get to decide when you're going to do your treatment, for how long you're going to do your treatment. So it's going to be fitting your lifestyle. When you do dialysis at home, all those frequent trips to the dialysis center, they go away. So you are making up time again for you to have your personal activities, maybe go back to work if that's something that's important to you, and spend some time with your family. We've had this young lady, she was very active, very social life, and she had to start dialysis as a teenager. And then later on, she joined the program where I work, and she was in her 20s, and social life is very important. So when she decided to do home hemo, she wanted to do 6 times a week, 2.5 hours. And she says, I don't want this to interfere with my social life. So when she went home, she put the machine in the middle of her living room, and she would entertain at the same time as doing dialysis. So she got the benefit of both. And, I thought that was quite great for us to take that on. The other big benefit of doing home hemodialysis is that it can improve your health. It doesn't always, but most of the time, patients will feel improved. They will have less fatigue, and they will overall feel better when they do home hemodialysis. And I like to give a little bit of analogy with that. So think of a healthy kidney. Your healthy kidney, it works 24/7, 7 days a week. It does not take a day off. So when you go to the dialysis unit to get your treatment 3 times a week for 4 hours, during those 4 hours, this is the only time that your kidneys are kind of working. So it's great, it helps, it works, but why not give more time on the machine to help, simulate kidney function? So, again, doing less time, but more often can be more gentle on your body. Again, maybe not everybody will work for everybody, but usually, as a rule, it does improve your health. The other benefit is that you can really tailor your dialysis schedule and your treatment to what fits best for you. So patients feel like they're regaining control over their life and over their environment. So think about, when you go to the hospital to do dialysis, you may be dealing with lovely nurses, very experienced nurses, but it may be always a different nurse. And that nurse may be the first time she meets you, so she doesn't know you as well as you know yourself. When you do home hemodialysis, although it's a learning curve, you get to become the expert of your own health, and you regain that sense of pride, and oftentimes patients can tailor their schedule and their treatment to what works best for their health. How much fluid to remove, how many times a week works best for you. So that's oftentimes what patients will tell us. Now let's talk about the concerns, because for every benefit there's also concerns, and really the top one concern that patients have voiced to us, and I'm sure you may be in the same boat, they feel scared. They don't feel that home hemodialysis is safe. And maybe yourself or maybe your neighbor at the center, maybe they've suffered, they were not feeling well on dialysis, they had a low blood pressure, and all of a sudden you have 3 nurses rushing to the bedside, and that's very, very intimidating. And I've heard from a lot of home hemo patients, they said, when I see that, I don't want to do home hemo, because how am I supposed to take care of an emergency if I don't have 3 nurses rushing to my bedside when I'm at home? Like, how is it possible for me to overcome that? So what I can tell you, the fact about safety in home hemodialysis is that you will be provided a very, very good, reliable training for performing your treatment at home, but also training on how to respond to any emergency that could happen at home. And the training nurse that will be assigned to you during those 6, 8 weeks, whatever time it takes you to learn, will not send you home if she feels that you are not ready. This is not a time-sensitive training. It's about sending you home when you are comfortable, when the nurse feels comfortable. And again, another thing that we do, we teach you to have safe treatment at home. So we want to avoid any of those emergency situations. So we are going to train you how to assess yourself, how to not put yourself in a dangerous situation to begin. So that is part of the training to assess, do you have a lot of fluid to remove today? Do you have a fever? Do you have any signs of infection? If you have a lot of fluid, remember, this machine is at home every day, 7 days a week, living with you. So if you want, you can remove that fluid over 3 days instead of 1 day. So all these potential risky situations that can happen in center, they do not have to happen at home because you have that machine accessible to you and you can use it as needed. So again, you will also have a team that's available to answer phone calls if you have any question, and you will be encouraged throughout your training, and you will practice those emergency phone calls as well. So safety is actually home hemodialysis top priority. Your safety is our priority. So we would never put you in an unsafe situation. If we feel that you are unsafe, you will not be sent home. That's just how it is. So the next concern that patients have is that, how am I supposed to learn this big machine? How am I supposed to answer those alarms? Like, we are nurses and we have to learn how to do this. Like, how am I supposed to understand this technology? So that's a very valid question. When I started in hemodialysis, I was overwhelmed too. I'm like, how am I going to learn this machine? I struggle with a computer, but repetition makes perfect. So we teach you small task, simple task. We start with things that are not so intimidating. What is sterile, what is not. We understand you're not nurses, so we will teach you dexterity techniques as well. So you know how to draw something in a syringe. Everything will be taught at your own pace. Again, like I said, there's no training, there's no speeding in training for home hemo. It's your pace. It's not our pace, it's your pace. And we design the training based on your learning style as well. And again, teaching by repetition, it's what works. So the more you do it, the more familiar you will get with it. And again, remember, nobody became an expert in 1 day. And we certainly don't expect you to be expert in 1 day. You will always have access to dialysis nurse through phone calls. Some centers have on-call home hemo services 24/7. Some centers don't. So I would, advise you to check with your center before considering it, if that's a big thing for you. Other concern that patients have voiced to us, and that was mostly patients who were already on dialysis in the center. They were worried about switching to home hemodialysis because they were worried they would feel isolated. They would say, I like to be in the waiting room with other patients and we talk about, what's been going on the weekend. And they worry that, if I choose home hemo, I'm going to be by myself at home. And that's not going to be, something I want to do. What I can tell you from experience is that strong bonds and friendships are made in home hemodialysis. So we have many patients during training, you're both on the same boat, learning this machine. It's not easy. And for, the next 6 to 8 weeks, you spend every day together going through the same growing pain. So like I say, a lot of friendships are made between patients during training or during clinic visits. And the other portion of isolation, patients, they like to see the nurses when they go to the in-center unit, which I understand that as well. But what I can say, a fact, in home hemo, you will have access to a very small team of very dedicated nurses who will know you inside out, because again, it's a smaller group, small team of nurses, and they will be there to provide very tailored care to you. Same applies for the nephrologist. Some patients, they feel, I want to see my nephrologist every week, where in home hemo, it will be only every couple of months or more if it's needed. So again, you have to see what works best for you, and then make the decision according to that. I wanted to just quickly touch base on infrastructure required to perform home hemodialysis currently. I'm not going to spend too much time on this slide, but I thought, maybe there may be questions about that. Again, like before, what we look at is not so much the kind of house you have, if it's nice, if it's not nice, if it's huge or if it's small. We looked at safety. Is your house safe to perform home hemodialysis? If there are any, suspicious things in your house, or if there's any other potential risk to the healthcare team or even yourself, we may, have a discussion with you and see if you can remove some of those potential unsafe situation in your home environment before beginning the training. But again, that doesn't mean it's a no. It just means it's a discussion and maybe some change that need to happen if you're ready to make those changes. If you're in a situation where you are renting, home hemo units will require the landlord to sign an agreement stating that they are okay for the dialysis unit to perform renovation. And those renovations are mostly electrical and plumbing. It's done by professional. They obtain permits for all that. So nothing has to happen on your end. Everything is looked after by the hospital. In terms of those renovations for electrical and plumbing, there is no cost to you. Everything is paid by the Ontario Renal Network, so you do not have to worry about that. And patients often wonder about supplies. Am I going to have to pay for my supplies? No, you will not have to pay for your supplies. Everything will be delivered to your home on a monthly basis. Sometimes they do accommodate twice a month if you have a very small place. So those are discussions you have to have with your home hemo team. So again, no cost to you for supplies. So that's just touching based on that. And then here, coming to the end actually already of this presentation, is it the right fit for you? And I'm just going to go over a list of questions here. Ask yourself the following questions. And then you'll know if the answer is yes, maybe it's the right choice for you. If the answer is yes, but maybe not right now, then just, wait until your situation clears out and then see if that's something you want to do. So ask yourself this question in terms of your lifestyle compatibility. Do you prefer flexible treatment schedule, or do you prefer to have your 3 times a week in center and not have to worry about anything? Ask yourself this question: are you comfortable managing your own care at home, provided, of course, that you will receive excellent training and have support at home from the home hemo team? And you live far away maybe, and you're struggling to make those trips back and forth to the dialysis center. If that is the case, maybe home hemo is right for you. What about your health requirements? Have you heard from your nephrologist that you may benefit from more frequent dialysis? Some patients already have to do 4 dialysis in the in-center unit. So maybe that is a sign that maybe if it's right for you, maybe you should try doing dialysis at home. Maybe do you think you can manage the responsibility of doing home treatments and stay disciplined with those treatments? I've had a patient, she says, oh, I'd like to do home hemo, but I'm not disciplined in doing my treatments. So maybe that would be a recipe for disaster for me. Where I've seen the opposite, patients who were not very reliable and coming to their treatments at the hospital, but once they were home, they were dialyzing more than they ever did before. So again, it could go both ways, but you know yourself best. And what about support system? Do you have maybe a family member or caregiver that would be willing to help you with this workload? We can delegate some of the workload of learning home hemo to a caregiver, a family member. Maybe you have somebody that would be willing to take on the whole training if that's not something you are physically able to take on. That's happened before. And again, are you comfortable to seek help from the healthcare team? Or are you not going to be reaching out if you are running into problems? Because if you don't feel comfortable reaching out, when you run into problems, maybe home hemo is not right for you, because then you wouldn't be safe. And then the big question, training and your readiness to learn. Not everybody is in the right place, at the right time to be able to learn home hemo. Learning home hemo is a huge commitment at the start, but you will benefit for years to come from that initial commitment. So are you willing to undergo a thorough training for home hemo? Are you able to take that time off work? Or, do you need to prepare or tell your work, I'm going to need 6 weeks off, So, the timing of your training is very important. And another question, ask yourself, am I prepared mentally, physically to handle any emergency situation? Maybe you have some other crisis going on in your life. Maybe you have a sick child or a sick spouse. Maybe it's not the right time for you to take this on because it's a lot of work. But maybe if things settle down, then you can consider doing that. So again, speak to your nephrologist, speak to your team, and you know yourself best what would work for you. And now we're at the success story, and like I say, success can look very different from one person to another. And I put success story, when a patient has been dialyzing in center, or even they just start dialysis and they say, I want to try home hemo, and they try. And we've had patients, very few, that tried sometimes for 4 weeks, 5 weeks, 6 weeks. And then they said, what, I can't do this, I can't do this. And they go back in center. You can always go back in center. In center will always forever be there. So, they give it a try and it didn't work, but at least they know that they give it a try. And then they just go back in center if it doesn't work. So to me, this is a successful story. Like I say, success can look different for many different patients. I like to tell, we trained an 80-year-old patient and his wife, same age, did all their learning. Typically, a patient learns in 6 weeks. This patient, it took them 3 months to learn, but then they lived many years doing home dialysis. And it was, amazing to see that. That was an amazing, successful story. We had a patient, she was palliative, but chose to continue on dialysis. And one of her family member chose to train and perform treatment until her final days in the home where she felt the most comfortable. We had several patients living very far away, and they couldn't drive, and the cost of the getting a driver was just, crazy. So they trained partially in the hospital, and then the nurse finished training in the home, and he's been really happy dialyzing in his home, in his basement, and it's worked really well for him. And when I talked about accommodation, we trained a patient that did dialysis in a trailer park, in a nice trailer. And we've also been successful in training patients on the autism disorder. This patient was not doing well in center, but did beautifully at home. So, different story. Everybody comes from different background, and your story could be different. But, unfortunately, not everybody can do home hemo. But I would always say, if it's within your abilities and if you have a support person, it's always good to give it a try. So this ends my presentation about home hemo, and then I will switch over to the kidney portion. So I will do that right now. So